Welcome to Park Avenue Plastic Surgery Class, the podcast where we explore controversies and breaking issues in plastic surgery. I'm your co-host, Summer Hardy, a clinical assistant at Bass Plastic Surgery in New York City. I'm excited to be here with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. The title of today's episode is Male Plastic Surgery. We know women love to think about beauty, but what about men? Are they part of the explosion in plastic surgery as well?
To bottom line it, the answer is definitely yes. Both the numbers of procedures and the percentage of procedures in men is growing, but it's still a small minority of the total. According to the Aesthetics Society statistics, as well as those from the American Society of Plastic Surgeons, the percentage was around 5 to 6% in 2022. That's the last year for which statistics are available. Still, this small number really understates the importance of appearance to men. Men don't think about personal beauty exactly the same way as women, but they are still very concerned with their self-image and the image they project to others. Appearance is a huge part of that.
That makes sense. So what can you tell me about this, Dr. Bass?
Well, let me turn to our guest to discuss this issue. Today we have with us Dr. Douglas Steinbrech. He is a board-certified plastic surgeon who trained at the Institute of Reconstructive Plastic Surgery at NYU, where I trained. And he is really a master of body contouring and minimally invasive approaches in plastic surgery. He's been especially active in defining plastic surgery for men, including editing the seminal textbook on the subject entitled Male Aesthetic Plastic Surgery. He was gracious enough to ask me to write a chapter in that textbook on cheek augmentation. Dr. Steinbrech, welcome.
Thank you. It's a pleasure to be here. Thanks for having me. I think it's a great topic, a topic I'm a big fan of.
Welcome, Dr. Steinbrech. So let's get right into it. What are the aesthetic issues that men pursue most often?
Yeah, it's really a variety of things, but what I see a lot is with aging, it's a couple of things. For face, the men are concerned with their neck and really the jawline or the jowls. And the point of, as Dr. Bass said, the point of where the cheek is. When it comes to body, they're more concerned about being fit. We're currently in a wave where we're inundated with Instagram and social media, and everyone's watching everyone, and everyone's actually putting everything that they have on the internet or on their phone. And so people are seeing a lot more, they're comparing a lot more, they're seeing a lot more skin. So this has sort of shifted people's interest in fitness and interest in looking good. So from a body perspective, a lot of men are coming in asking for improved body contour. They're interested in more dramatic fit appearance, and particularly in those areas that are stubborn. Everybody's going back to the gym, but the areas that the gym can't quite cover, that's where we come in. And then the other thing that we could talk about later is how much massive weight loss and even moderate weight loss with GLP-1 copycats or Ozempic and these sort of weight loss drugs, how much that's really shifting the landscape in terms of body contouring for men.
Okay, that's really interesting. You touched on this a bit in that answer, but separate from what men are actually looking to address, are there differences in how most men approach or think about plastic surgery compared to most women?
Yeah, I think men they're interested in, like I said before, they're interested in looking like they used to look when they had more time to invest at the gym and before there were changes with their genetics. And that's what we see a lot. We see a lot that men want to be back where they were when they were in their 20s, before the testosterone change went down a little bit, and before work and family responsibilities really came into play. The other thing is about how men and women And when I say any of these things, I'm trying not to generalize, and I'm definitely trying not to be sexist. I just find that people have different approaches, and a lot of times men tend to not want to shop around. They tend to want to do the research, look online, see who looks like they specialize in this area, and sort of like they know that they know that they've done well this year, and they know that they want to go out, and if they do really well at work, that they're going to get themselves that BMW or that Mercedes. They walk into the Mercedes shop knowing that this is what they want, and so instead of like shopping around to a bunch of different car lots, they kind of know. They know where they want to be. So they've already done the research when they've come to me. And instead of asking a lot of questions and comparing what I say to another doctor and going up and down Park Avenue, they usually feel like they've done their research and they treat me more like a consultant. They hire me for my expertise for my ideas of what I have. They listen to what I have to say, and then they usually allow me to execute that plan. So from that standpoint, I really enjoy working with men because, and a lot of women are this way too. Again, I don't want to generalize or I don't want to be sexist, but I just find a lot of men, when they come, they've already made their decision. It's just where they want to know what is the best way, and they seek my advice as an advisor, as a consultant.
Got it. Okay. So if we look at procedures that men are specifically focused on, what are some of the differences in how those procedures need to be performed?
Yeah. So, one of the things is for women, we see a lot. I always say women are interested in 4 bumps, which means 2 bumps in front and 2 bumps in the back. In general, again, this is in general, like we just want to have fun. But men are interested in a lot of different bumps. So it could be a 6-pack, an 8-pack, delts, anterior, lateral, posterior delts, traps, chest, biceps, calves, triceps. So all these areas. And we accomplish those in a couple of different ways. One is using your own, I call it body banking. It's using your own cells, your own fat cells, taking them out of the bad areas and then moving them into good areas. So that's what we call body banking. It's taking all those cells and transplanting them to a good aesthetic area. So by subtraction and then addition, we can completely, like an artist uses clay to create a more artistic or athletic result. I could do the same thing with my clay, which is a patient's own cells, their own fat cells. So we find it does a couple of different things. First of all, it gives them a better artistic result than just throwing the fat and putting it in a bucket. I think that's a complete waste of time. You wouldn't imagine a clay sculptor just removing the clay and throwing it away. That's a complete waste. He takes some and then he adds it to other areas. So that's what I do. But then the second thing about it is we're just starting to understand a couple of the rules or the dynamics of fat grafting or lipocell transfer and what it means. So I've kind of studied this and I've looked at this. And what we find is that if patients just have liposuction and they throw away the fat, that they can get what we call rebound fat. So that's fat showing up in other undesirable locations. So let's say if you have a dude that comes in and you do liposuction, I used to do this all the time. I used to do all the liposuction, really make his abs look great, really make his flanks look great, throw away the fat, and then they would come back. And if they didn't increase the caloric burn or decrease the caloric intake, they're still getting excess carbohydrates, excess calories, and they're developing, they're feeding those fat cells. Well, guess what? If I didn't bank any fat cells on the outside, then it's going to come back. If I threw it all in the bucket, the only fat cells left over are visceral fat cells. That's belly fat, fat inside, behind your abdominal wall. And so I see it. So when they come back, 9 months later, after they're all healed, they come back 9 months pregnant. So now that we get smarter, now that we bang things, I bang things in your shoulders, traps, chest, into the glutes, into the calves, wherever we put it, they can relax with their diet. Maybe they can have bread with dinner, right? Can you imagine? Or even have dessert. You don't have to live a life without pleasure. And now when they do it, the doctor said to do it, they get more upper volume cleavage or upper chest volume. Their traps pop and their shoulders widen. So this is what our patients find. And they're really, really not only happy about their abs, improving their abs, but now they have all this great volume in other desired areas. And they look great at the beach, at the pool, but they also look great, playing golf with the polo on. And as you get older, Mother Nature plays a couple of tricks on you. She turns down for men, she turns down the testosterone, she turns up the estrogen. So as she does this, as you move into your 40s, 50s, 60s, 70s, and as this happens, instead of all those fat cells getting larger around your belly or inside your belly if you had liposuction, what happens is it increases in size relatively. There is the got banked, the desired areas that we put in. So I always tell my patients to write me a thank you note in 25 years if I'm still around. But we immediately have people a year or two out that are really, really pleased. And so that's the other advantage of it.
I think that's a really important point. Liposuction started as this treatment for people, back 40, 50 years ago who were ideal body weight with very focal areas of extra fat. And if you do liposuction on someone like that, a 25-year-old with a teeny bit of fat in the love handle area or something like that, that's great. But we've really, really broadened the application to people who are older, people who are not obese. It's not a treatment for obesity, but for people who are overweight, which is almost all of us Americans. And when you're treating that population, the fate of the body when you take the fat away becomes different, as Dr. Steinbrech described, because that visceral fat is more metabolically active. It's bad fat. And if you're in a weight gaining stage of life, unless you radically alter your lifestyle, then liposuctioning out subcutaneous fat, which is not as metabolically active and consequential in a bad way for you, is more likely to get you in trouble, where taking that fat and putting it someplace where you need it is protective and aesthetically useful. So it's a win-win, isn't it, Doug?
Absolutely. And just for the women out there that are listening and not believing this, before we did BBLs, or now I say gluteal augmentation or buttock augmentation, but we used to say Brazilian butt lifts. Before we did that, Dr. Bass and I used to just do liposuction on women, and then we do a tummy tuck. And I would do my very best to suck out all the fat, but we threw it in the bucket. We didn't know any better. We never put in the glutes or any place else. What would happen is the patients really wouldn't be great about going to the gym and wouldn't be really great about decreasing their post-caloric intake. And so they would get this rebound fat, or what I call catch fat, compensatory adipotropic cellular hypertrophy, which just means cells in other areas compensatorily enlarge unless you do change how much you take in or how much you put out. But what would happen is 6 months later, I would have these women come in and they would look like a truck, because what I took out, we didn't bank anywhere else. So I didn't put in the glutes. We didn't really do BBLs then. We just threw all the fat away. And they would come back they would come back looking like SpongeBob SquarePants. They would have a lot of visceral fat, almost like they were pregnant. You'd have an unhappy patient and an unhappy husband. But now, to illustrate the point, everyone sucks it out, and they put even, maybe less than a couple of years ago, but put something somewhere else. And usually it's in the buttock for women. And now they come back 6 months. You're a genius. Doctor, you're a genius. The husband is in love with you. The patients are in love with you, because guess what? They went home. They did not change how much they ate. They did not change how much they burned. But instead of coming back as visceral fat, it came back in their backside, and the husbands and the wives were in love with you. So that just further illustrates this the point.
This is a really interesting discussion. I hadn't thought of any of this before.
Yeah.
Is this just a different aesthetic endpoint then, or are the actual techniques different?
The techniques are different as well. And also, the philosophy is different and the postoperative care is different. And I'll tell you why. Postoperatively, well, also preoperatively, I put people on a slightly elevated carbohydrate diet so that their cells are a little bit larger, so that more of them survive the transfer postoperatively. And then postoperatively, we keep them on a high carb diet and a high protein diet, but really high carb diet for 28 days to make sure all those blessed cells that we put in their new location actually survive. Because we really don't want someone to be in starvation mode, because your body prioritizes the most important thing. What's going to be the most important thing? To heal up, not to keep any exogenous fat cells that were transplanted. That's really not your body's priority. Your priority is heal up the surgery that just got done. So we want to give them extra carbs to keep everything there. And that's really sort of a change. A lot of times, surgeons don't stress or emphasize higher carbohydrates postoperatively. And to get the patients to do it, they came to have liposuction to get lighter, to really tell people that you need to do this. That's something that you have to massage with the patients as well. And the other thing about what I do is a lot of postoperative molding. We use a lot more foam with the procedures. And we spend extra time really talking about compression wear to make sure everything heals as evenly as possible, as polished as possible, but also to make sure that the transition zones from what we've subtracted to what we've added are nice and smooth, are aesthetic, are make sense, and are natural appearing.
So then where the techniques are different, does that mean that the instruments are different as well?
Yeah, well, one thing that I have and I've developed is scarless abdominal healing. And you may see somewhere when you go to the beach or the pool, you may see some guys that have had abdominal sculpting or abdominal etching. And their abs, their stomach looks like a tic-tac-toe board. And they have 6 different incisions right on the skin, right visible. And God forbid, if they were a little bit darker complected, maybe we call it Fitzpatrick scale, a scale from lightness to darkness. But it might be a patient that may be a patient of color or a patient of the thicker dermis. Some of these guys that may be Latino or Black can have problems with hypertrophic scarring or keloids. All right, those are those big bad scars. So if you're giving them a scar that's right on their abdomen and it scars poorly, when sometimes they look ritualistic, they're going to have scars that obviously show that they've had abdominal sculpting. So I tell everyone that we need to have, and I have curved cannulas, so that, I can hit all the points from 2 small incisions underneath your swimsuit or through the belly button or a little nick through the nipple that nobody ever sees. So I can hit all those sites without any scars on your abdomen. So we developed this in 2017. It's called scarless abdominal sculpting. And I always tell the residents, and I tell when I'm speaking, I have to speak in Cartagena next down in Colombia, and then we're going to Greece and then Australia. So when I talk to people at these conferences, I always tell patients, I've never had to apologize for an incision that I did not make, right? If you don't make the incision, you don't need to do it. And frequently I'm at a conference and I'll talk about this and I'll sort of beat on people about this. Stop making these incisions. We have the tools and the technologies not to have that. And then the next doctor that gets up and gives his abdominal sculpting talk make sure his incisions I just told everyone in the audience not to make. So it's kind of tricky.
Yeah, I think, that's a lesson from the whole field of minimally invasive surgery and plastic surgery as well, that the smaller the incision is, the further away the incision is, the more it becomes critical to have exactly the right instrument that empowers you to do what you need to do. And if you try to do it with just a conventional instrument, you try to struggle, you're not in the right position, the instrument's not configured properly. So that contribution that you made of developing instrumentation that enables this whole process was really one of the tremendous steps up for accomplishing this in a way that keeps the entire abdominal area looking great instead of a jigsaw puzzle of a bunch of little incisions, as you're saying. I've always tried to tilt towards the absolute minimum of liposuction incisions, of fat grafting incisions. And there are some surgeons that go with very short cannulas and make many incisions every 4 inches or so. And I've just never understood that approach. So I think you're right on.
Yeah, and that's frankly, that's one of the problems with a lot of these new technologies. The companies are more interested in making money, so they make all the probes very short, so that you can't use the body probe for the neck probe or anything like that. And by making them short, inherently, people just have to make more incisions, which means more scars on the patient. And unfortunately, I dare say that for the companies, sometimes the priority isn't the patient or the patient's scars. The priority is like how many of these things can they sell. Sometimes, unfortunately.
Yeah, I mean that's the thing. We often use a few different liposuction cannulas in terms of what the apertures look like, the holes that actually shear off the fat, or in terms of the curve of the cannula or the length of the cannula or the diameter. And as soon as you go to an energy-based technology, either applicator or cannula, you can't really buy more than one for a case, which means by definition, you're using one disposable cannula rather than I've had a lot of cannulas for 20 years and we just put them in the sterilizer. They're steel. They get cooked, they're sterile, and we use them and use them and use them. But I can pull on that family of cannulas for whatever exactly I need in that instant to get the shaping I want, which you lose when you transition to a single cannula approach.
Right.
That's an interesting point. I didn't think of that. So I'd like to kind of focus in a different direction from body. And you mentioned that neck and jawline are one of the big things for men because it does give them a worn, tired out look, and nobody wants to look that way, especially if you don't feel that way. But this is also a procedure, of course, that women do commonly. How do you approach facelifting or neck lifting for men? How are your incisions different? How is it different what you're doing underneath with your connective tissue layers? What's your thought process for this?
Sure. Well, men are a little bit different than women, and for neither for men or women do I like to do like the old-fashioned surgeons really in the 60s, 70s, and 80s, which was kind of wait till everything falls apart, and then they get these Park Avenue matriarchs and they put their foot up on the table and pull as much as they can so that patient is like very windswept. So a couple of things that we do for the men is men would rather have A, not look feminized, and B, not look overdone or or look like they did have surgery. So for the men, they'd rather, and this is one thing. I remember I had this lady from Texas when I started out my practice. She said, Dr. Steinbrech, I want to be pulled so tight that I only have one line and I want to be sitting on it. And I just thought, like, first of all, it was very clever, but men don't want that. And for men, what we want is, I always talk about something that looks, some lines are character, and there's nothing that looks more artificial for me is just see a man that doesn't have one single wrinkle, one single anything. I think that it's a few lines here or there are sexy. We just don't want to look old or older than our age. So number one, priority for men, they'd rather have less done. And I always tell my patients, I get in the same sync with them. You come to me because you want to stay looking masculine and you don't want to look like you had surgery and you want to look like you don't look like an alien or a woman. So for my guys, I say, if there's anything that you're going to be displeased, it's because there's a little, you wanted this to be completely gone. I never say gone. In my practice, I always say improved. After I speak with them and they realize that they don't want to look overdone or overpulled, God forbid, they do understand that. And it's about setting those expectations that makes them happy. In terms of technical differences, For the men, for the women, what we do is we take their skin, we put it all the way behind the tragus, and into the ear. For the men, I don't do that because they have hair bearing, they have that beard. I bring it right up to that little line that everyone has, we call pretragal, that has in front of the ears. But what I do is I do something different. What I do is I make sure I see some, and in fact, I went to a laser show. I don't want to get too specific because it's going to reveal the person, but really fantastic lasers. Vice president could have gone to anyone that he wanted to, but I could see when he had his facelift, the incision went straight down. It was about a half inch in front of the ear and then came back. Dead giveaway of someone who's had surgery. There's a poor match. There was a straight line. What I do is different, is I make sure I go around each individual, and most good plastic surgeons do this, but I still do see some guys when I go out to Southampton and go to dinner and I see the guy at the club that has an incision that came straight down. So we always blend it in with the natural structures of the ear. When my mother was putting together wallpaper in the dining room, her floral wallpaper, she would painstakingly cut around every fruit and every flower so that there were no seams in that wallpaper. And I do the same thing so you don't see it in men. The other thing with men for the neck, we start with injectables. So we can go a long way with even removal of fat with Kybella, and that's just an injectable. Or I can do liposuction with necktie, which is radio frequency. Next step up from that is we make an incision and bring the platysma muscles together. It's a platysmoplasty, where we drape the skin, along with removal of fat and tightening the skin. Next step up from that is just a short scar neck lift that just comes around the ear. And that improves the neck, but won't take care of the jawline. If you really want to take care of the jawline from a non-invasive way or an injectable way, I can do what I call my male model makeover, which is more into the cheekbone, more along the jawline. I have a special way that I do it to make sure that you don't look like a mobster, which I've seen several people do because they're injecting in the wrong place. But I inject it a certain way so they have a more a stronger, more defined jawline. And then when it comes to surgery, if we want to improve the jawline and the cheekbone, a little bit of the nasolabial fold is do a full neck and face for the guys. So that's pretty much the entire realm. Oh, one more thing is what I sort of call is a Clint Eastwood neck work, which is somebody that says we have a lot of guys that come in their 60s, 70s, maybe even 80s, who say, Doc, I just get rid of the turkey neck, get rid of the turkey neck. And for those people, I can do it under local. We can remove the skin directly. But the reason why I say Clint Eastwood is because it's got to be a certain patient that has weathered skin, a lot of natural sun aging, a lot of creases, crevices, and crags. So that when you do directly size that, the resulting scar can hide quite well under that weathered skin, but it's really not something that we do in a younger person or a person that doesn't have a lot of skin damage. That's it.
Yeah, so there's this big range of options, and I think those are all really important points. I mean, one thing about face and neck operations is they're not just loose skin operations, they're shaping operations. And so by definition, a male face shape is different from a female face shape. And it's really, really important to reinforce the maleness of the shape in a man and not feminize the face or the eyelids. And I see that all the time from people who just have one approach. And one approach isn't even good for one gender. You obviously have to customize your approach based on what's going on in that individual patient's stage of aging. But it's really important to do that with the goal of reinforcing a male facial shape. And that incision location and tailoring in is just part of that good plastic surgery training that we got at NYU. And Summer watched me making that kind of an incision last week on a very nice 77-year-old gentleman who still works full time. And that kind of incision works better than trying to pull that thickened, weathered cheek skin over the tragus, the little button in front of the ear. That's going to look poorly matched and not hiding the incision right in the crease in front because you're worried about the hair bearing and non-hair bearing areas of the face likewise is going to leave you with a giveaway, which is essentially avoidable. So these technical details really make a critical difference in preserving a natural look, which is always the goal for men. I think you said a mouthful when you said that, because that is 100% what the job is about. If a man comes out looking natural, younger, fresher, rested, then it's a success. And if you make any kind of alteration, it's really a bad day.
Absolutely. Couldn't agree anymore. The other thing I would touch on is the support and bony support. And that's the other thing that we have to think about, because just like you said, this is just not just loose skin surgery. If it was loose skin, you would just bring it up. And the problem is as men age, I always tell my patients when they're in their teens, like one of the reasons why guys look so great in their early 20s is, they may stop growing when they're 18, 19, 20, but the jawline continues to grow until you're around 27. Your 27th birthday is, it starts to recede. So if you take if you took the mandible, the skull mandible from a 27-year-old and then a 72-year-old, we're going to flip the numbers there, you're going to see a lot of resorption of that bony area. So this, if you bring up the skin and you've lost a significant amount of your mandible, the actual bony portion of the mandible, you're not going to look right. You're going to look foreshortened and lack projection. And you're going to lose that masculinity. And you're not going to look like you looked in those pictures that you brought from 20, 30, 40 years ago. So one of the things that we do have to do is replace, we say like with like, but what we need to do is we need to recreate that extra fullness. And we can do that during a neck lift or a facelift. Usually after is better. We reset the tissues after they've reset and healed. I go back in and I give that extra volume of that bone with injectables. I can do it with fat, or I can do it with hyaluronic acid, which are injectables off the shelf. And that not only makes the patient have a more chiseled, more masculine, more defined jawline, it catches the light and throws a shadow that gives that really straight, strong, masculine look, but it also makes you look more like you look like when you were 27 years old, because we recreated your jawline that you had when you were 27 years old, so you look younger as well.
Wow, that was a lot of small details that I hadn't considered, but are clearly really important when considering plastic surgery for men. So as we prepare to wrap up this episode, Dr. Steinbrech, what takeaways do you want to share with our listeners?
I think the key thing is when you're looking for men's plastic surgery, what you want to do is do your research, right? You want to go to, anybody can, a lot of people do, they buy the Google terms for male plastic surgery. New York's best male plastic surgeon, or they'll say Phoenix, best male plastic surgeon. But then when you go to the website, it's nothing but orchids and butterflies, right? And then really it's when you go to the gallery and you're trying to find one man in their gallery of their before and after photos, and all you see are hundreds of breast augmentations. And you're really not looking for a breast augmentation. So it's to do your research. And then the other thing is to also make sure that they're a member of, that they're board certified in plastic surgery. And even higher than that, a higher level is that they're a member of the Aesthetic Society. So those, I think, are really important things when you're choosing your plastic surgery for male plastic surgery.
And what are your takeaways, Dr. Bass?
Well, we've talked about some of these things before on the podcast, but the way plastic surgery procedures are done, the parameters, the measurements and metrics are different for men and for women. We've kind of scratched the surface here talking about body banking and talking about face and neck shape, but for every procedure, it's going to be different for men and women. The aesthetic interests of men and women go head to toe, but there are certain aesthetic issues that are more commonly of concern based on gender. We're limiting the discussion in this episode to individuals that identify in one of these two simple baskets of men or women, but we must acknowledge, as Dr. Steinbrech did, that there are individuals that don't fit into one of these simple categories based on how they identify or based on their aesthetic goals. So for that reason, it's really important for patients and their surgeons to discuss the aesthetic goals and the aesthetic sense of beauty ahead of time to come closest to producing the patient's vision of beauty in reality. In summary, men are definitely interested in plastic surgery and increasingly interested. The procedures have improved to match men's needs, and that's in part due to excellent instruction in how to customize these procedures for men from leaders in male plastic surgery like Dr. Steinbrech. There are a lot of subtle features and some very obvious features that say male or female, and it's critical to understand both the big and little features and build them into your plastic surgery procedures if you want a nuanced, natural-looking result. So I'd like to thank Dr. Steinbrech for joining us today. It's been a lot of fun to talk through this topic with you.
Absolutely. Thank you for having me. I really enjoyed it. Some great questions. And I really hope that people go out there and explore it more.
Thank you, Dr. Steinbrech, for sharing your extensive expertise in this area. Thank you for listening to the Park Avenue Plastic Surgery Class podcast. Follow us on Apple Podcasts, write a review, and share the show with your friends. Be sure to join us next time to avoid missing all the great content that is coming your way. If you want to contact us with comments or questions, we'd love to hear from you. Send us an email at podcast@drbass.net or DM us on Instagram at drbassnyc.